Bueno, vamos con Frank. Frank, hemos tenido un tema tecnológico. Entonces, para hacer la demostración de cómo funciona la app, va a empezar a dar la charla desde allí, porque necesita conectarse con el Bluetooth y empezará la charla allí, oiréis hablar, esto es como los Oscars, y luego vendrá hacia el estrado. Frank, adelante.
Thank you, David, and the GESOC organisers for asking me to speak about the app that we use for antimicrobial treatment at Moorfields Eye Hospital. I'm going to just present from the back of the room with the audiovisual experts, and then I'll finish my presentation with some general information about the app on the podium. I thought it would be interesting for you to see me just using the app in an interactive way. So this is the first page, the home page of the app. You can see the phone page, and you enter. And this is the menu that you see on the app, so you can read this list. It starts with conjunctivitis and goes all the way down to feedback at the very end. I'll open some of these headings for you to see the way that the information is presented. I would say that all of the information I'm giving are simply the guidelines for our residents and for our colleagues in Moorfields. It's already available on the hospital's intranet, and this is simply the information available on a mobile phone. So first of all, cornea and keratitis. So you'll see the subcategorization. I'll show you bacterial keratitis. So this is information. You'll have heard some of this morning from my colleague Stephen Tuft. So we start with levofloxacin or moxifloxacin, and the information is then given on second-line treatment, some comments about monitoring of patients on oral moxifloxacin for systemic side effects, monitoring for liver function tests. Another page to show you would be fungal keratitis. So this is the information on empiric first-line antifungal treatment, natamycin at the top of the list, amphotericin for candida, voriconazole, natamycin, etc. Further down the page, patients with extension into the anterior chamber, you'll see that we switch to, or we add, oral voriconazole, and information is given on second line and other treatments. Some information that's useful at the end of this page on intracameral dilutions. So this is helpful for pharmacies if you're working in an eye clinic, which is not part of a general hospital. The pharmacy will not have available the drops. So this is how to make voriconazole and amphotericin from intravenous solutions. So the pharmacist will find this useful. Mycobacterial keratitis. What else have I got here? Microsporidia. You can see just I'm showing you a range of different keratitis pages. Bleb-related infection, this is of more interest to my glaucoma colleagues, endophthalmitis following trabeculectomy. I'll show you one or two other pages. Surgical and post-op prophylaxis, endophthalmitis, bacteria and fungus. So this is bacterial endophthalmitis, first-line treatment, second-line treatment, and further comments on monitoring. I'm going to stop the demonstration now, and I'll give you some more general information, including how to download the app. Just give me 1 minute, please. So the whole field of healthcare apps is quite new. A few months ago, there were over 150,000 healthcare apps available. Note this comment. Very interesting piece of comment from Jeff Mulgan. Almost none of those 150,000 or more apps have been shown to improve healthcare outcomes. And I'm not showing you something that necessarily will improve healthcare outcomes, but it will make, at least in our institution, the information more readily available to ophthalmologists, whether very junior or very senior colleagues of my own. So we're talking really about making more information available. I am going to finish by showing you that there may be a way that this app that I've demonstrated can improve healthcare outcomes, and that relates to antimicrobial stewardship and prevention of resistance.
So the app that I've shown you is, we've been helped with this by a company called Horizon Strategic Partners. This was established 10 years ago as a spin-out of the Department of Health in the United Kingdom. They have over 100 healthcare apps. It's a good company, very innovative. This is the homepage that I've just shown you on the slide. So MicroGuide is our app is one of the microguides that they have prepared for us. They also have an app for pregnant mothers, an app for women who are on intravenous in vitro fertilization treatment, so advising the patient when to take clomiphene, this kind of thing. Very interactive, very clever. They also have apps for patients with diabetes, much more interactive than the app that I've shown you on the antimicrobial ophthalmic chemotherapy. And 3 years ago, Horizon Strategic Partners bought the only other UK company doing this work, which is called RX Guidelines. So I think that you'll probably hear about Horizon Strategic Partners in Spain and other continental European countries pretty soon. They're very ambitious and they do very good work. So how they help us is in this way. So they help us upload our information via the cloud. So there's no need for Moorfields to maintain or support the app. All we do is give updates. And Horizon Strategic Partners, for a fee, have given us a number of update options. I think we're allowed to do 4 updates at no charge. And it's a very reasonable cost. I don't know what it is, but I'm told it was very reasonable. So the guidelines are uploaded, or the updates are uploaded via a secure portal, and that is published onto the ophthalmologist's mobile phone, like my own, or on the hospital's intranet. And the updates, we've already done the second, version 2. We're preparing version 3. Like everything, you do one update, and immediately there are new ideas or new problems that you see. So the Moorfields MicroGuide app was launched 1 year and 3 months ago. As at December, 3 months ago, there were almost 1,000 downloads, and that means almost 1,000 ophthalmologists had downloaded the app, and about 3,000 now openings, people opening the app to get information. So many people have downloaded the app, but they haven't opened it, which is what you'd expect. It's free, open access. If you want, you can all download the app, no problem. The guidelines are local to Moorfields Eye Hospital. Very, very important. As Stephen and Bruce said this morning, resistance patterns, susceptibility patterns may be different in Spain. They are definitely different in Asia, particularly India, and they are different for some pathogens in North America. Most of what follows for Moorfields will be good in Spain, but you must, I think, look at local information, and perhaps this kind of innovation is something that the organization GESOC might consider doing for this big population of ophthalmologists in Spain. So the current version is 3.2. That's the version that I demonstrated to you. Our next update, 3.3, will include a pediatric section, including where the ophthalmologist can put in the weight of the child, and it will automatically, quickly just do a very simple calculation to give, for example, the dose of systemic antibacterial for orbital cellulitis, or a systemic treatment with systemic antibacterial treatment. So that's a very simple, more interactive thing. Also, we will bring in hyperlinks to give more detailed information on specific drugs. Example, voriconazole, where we want to give detailed information on the monitoring of patients on voriconazole so that we can be at high surveillance for important systemic adverse toxic effects. I've shown the app to our colleagues in Australia, and the College of Ophthalmologists in Australia are now using their version of the app to develop a role among ophthalmologists in Australia in using a Royal Australia and New Zealand College of Ophthalmologists antimicrobial stewardship policy. So they want all the ophthalmologists to follow a guideline on first treatment of bacterial keratitis, first treatment of presumed bacterial conjunctivitis, etc., to try to reduce the resistance problem that they are already having in Australia and in New Zealand. So it could be that in Spain you can quite easily organize this. User feedback is very welcome. and I've sent the app to Dr. Anaboto and one or two other colleagues who are here, and they've given me comments, so you're all welcome to look. So these are the data on the downloads since the launch, the numbers of openings of the apps. This is the menu that I showed you a few minutes ago on the phone, and these are the 10 most accessed subsections on the app and within the sections. So no surprise, the number one consultation is for bacterial keratitis. You might think it's a rare disease, but ophthalmologists are very interested to know what should they be treating with. And I'm very pleased to see this top of the list. This is the one blinding complication in corneal disease, and it's terrific to see people taking care with therapy. And look at number 2, fungal keratitis. That's a rare disease in London. But even so, we're much more suspicious of fungal keratitis, as my colleague Stephen Tuft explained to you this morning. Blepharitis, I don't understand this. Why are ophthalmologists looking for advice on antibacterial chemotherapy in blepharitis? Anyway, they're looking. That's very, very common. Fungal keratitis is very rare. Bacterial keratitis, endophthalmitis, acanthamoeba, toxoplasmosis, preseptal cellulitis, periocular abscess, orbital cellulitis, viral keratitis, and number 10, corneal abrasion, surprisingly. And this is the full list. You've seen the top 10, and these are the others. So ophthalmia neonatorum is there, very rare, but this is usually treated by pediatricians in the UK. Acute retinal necrosis, you can read the list, but there are quite a number of subsections within the chapters I showed you in the app giving advice on more specific conditions. Now, if you'd like to download the app, make a note of this or take a photograph. You'd search for MicroGuide in the App Store or in Google Play. I've downloaded it onto a Microsoft phone, so you can get it on the Microsoft Store. And you select, you register with your own email address. You register, and then you select Moorfields Eye Hospital, and that'll bring you to the first page of the app that I showed you at the beginning of my presentation. And then you can access the antibiotic guidelines. If you have questions, this is my email address. This is the address of Tanya Serebrianska, who is our pharmacist, who is the lead pharmacist in our hospital for antimicrobial treatment. And she's preparing the update for the next app. So actually, if you have suggestions and comments, it's more important that you send them to Tanya than that you send them to me. But in any event, those are the contact details if you have feedback. And these details are on the app. Thank you for your kind attention. Muchas gracias.